Hello, this is Ken Barron with the National Association of Black and White Men Together. Over the last 40 years plus, we've been looking at the association, at the effect of people with HIV/AIDS. And it's been a big campaign in the old days to get the right medicine and everything else. But things have changed. HIV research cuts affect marginalized groups now. Of the 1.2 million people living with HIV in the United States, more than 60% are Black or Latino. Transgender women, gay and bisexual men and teenagers, and young adults of color face the greatest overall risk of contracting the virus in any given year. There is a disconnect between science and politics in the long war against HIV. 40 years ago, the infection was a mystery and a death sentence. Today, thanks to a combination of biomedical breakthroughs and diligent public health testing, education, robust social safety nets, it is a chronic but manageable condition that really only flourishes among society's most marginalized groups. The first Trump administration vowed to finally end the HIV epidemic by 2030, doubling down on prevention efforts in the hardest hit communities. The resulting initiative did pay off. Transmission rates are down in the targeted zip codes, according to the National Minority AIDS Council, a nonprofit devoted to stopping the virus's spread. Racial health gaps are narrowing as a result, and because prevention is cheaper than treatment, money is being saved. The second Trump administration, however, seems determined to reverse course. The future of HIV research became uncertain when it was caught in the crosshairs of the Trump administration. The Adolescent Trials Network, a massive research apparatus focused on treating and preventing HIV infection in teenagers and young adults, had been abruptly closed. A 10-year study on HIV and substance use in LGBTQ teenagers and young adults was suspended. So was another project on reducing HIV risks in relationships. Another project on how to improve the measurement of sexual orientation and gender identity in federal surveys was also done for. So are at least two fellowship programs for early career scientists who wanted to specialize in LGBTQ health. Salaries were reliant on NIH funding, and a lot of jobs are now gravely imperiled. Federal grants are the lifeblood of academic research. They support scientists and students, institutes, and administrators. They covered overhead costs. It is not uncommon to see one person to be funded by several grants. Likewise, medication that prevented HIV transmission, and this is known as pre exposure prophylaxis or PrEP, has become widely available. Within the gay community, middle aged white professionals have embraced the treatment as an ordinary component of overall health and wellness. But younger adults, immigrants, and racial and ethnic minorities still had not. It's not unlike birth control when it was first introduced. It's pretty straightforward as a treatment, but it's attached to all of those cultural baggage that makes it challenging to get across. Nobody outside the scientific community seems to realize what's happening. We have lost years of research in a matter of weeks. Whole labs have been closed and successful decades long careers ended. And none of it appeared to have anything to do with the quality or import of the research itself. The decisions were political and ideological. They were also arbitrary and needlessly cruel. Trust has been broken as a result. Whatever comes next, it seems extremely unlikely projects will be able to just pick up where they'd left off. Do you remember scientists having to cull words like, quote, gay and, quote, sex back in the early 1990s? But this was different. In the past, even if they had to change a word or two, they still got their research. Seasoned scientists are fleeing the profession, and younger ones are deciding not to pursue it at all. It's impossible to say what new medicine these minds might have developed or what wicked problems their efforts might have solved. I'm at the National Association of Black and White Men Together. My name is Ken Scott Barrett. We're on the internet at nabwnt.org. You can email us at nabwnt@nabwnt.org. You can also like us here, and you can uh, see us on all other platforms, including Facebook, YouTube, and Instagram. Thank you again. I look forward to talking to you soon. Bye bye.